We're here with Humboldt County Health Officer Dr. Teresa Frankovich for the July 31st media availability.
Hi.
Hi, thank you for being here with us. Number one, uh, can you speak to your understanding of current science on children and COVID-19? Are children still as unlikely to contract COVID as originally thought? If they do get ill, is there science about continuing side effects? Are there studies about the children transmitting COVID to at-risk populations?
So, again, because the nature of this particular virus and the fact that children overall are less likely to have significant symptoms, our assumption is that many more children are probably get infections than we ever become aware of. That being said, there is some emerging evidence that young children in particular seem to be not as significant in transmitting the virus, whereas older children and adults are a more significant player in transmission. And it's not really understood why at this point that young children aren't effective, particularly at transmitting COVID on large scales. It could be a range of factors that play into this. There are people who think part of it may be that because children are smaller and they're not as tall, they're breathing at a different level. Perhaps they're not exposing adults as much as another adult. It's possible that children, because of smaller lung volumes, just are not sort of expelling as much air and they're not putting out as much virus. It could be that they're carrying the virus a little bit differently in their respiratory passages and not transmitting it as easily. For whatever reason, it does seem to be true that younger children are less sort of vectors of this disease than older children and adults. We do know that some children can get severely ill with this. There's, again, emerging data about a multi-system inflammatory syndrome for children who get this that can cause sort of a vasculitis or inflammation in their blood vessels with other damage that can occur. So it's not that children are completely unaffected. It's just we know the numbers are much smaller in terms of children getting serious disease.
Thank you. With the troubling increase in COVID-19 cases and your sensible pleas to limit travel and family and other gatherings, why has the county not acted to limit the number of tourists by ordering short-term vacation rentals closed for the duration? Because Humboldt seems relatively safe, people are flooding in from places that aren't. Or are tourists not a significant source of infection in the county?
Well, there are a few questions embedded there. I would say a couple of things. One is that obviously, if you were going to limit tourism, it would mean not only closing short-term rentals, it would mean hotels, it would mean campgrounds, it would mean a whole variety of things. So it's a really broad impact to do so. The other thing I would mention is that we have when we look at a lot of the gatherings that we're seeing in our cases and such, we're not necessarily talking about people who are tourists per se, or even using local lodging and such. They're people who are coming to visit and stay with family. And that really has been a driver. We have not really had a significant number of cases related to people who were simply passing through our area at this time. It's certainly a reasonable concern, but we just have not been seeing that to date as significantly. It's also a logistical problem. It's very difficult, obviously, short of closing down Highway 101, to prevent people from coming in and through our county. And I'm not so sure that people are flooding here because it is safe per se, as much as people come here because it's a beautiful place and they want to visit Humboldt. And so I think that, this is a time we normally see lots of tourists in our area. And this year is astoundingly, to me, no different. People still seem to be out and about, even though we've asked them across the state to stay local. So when we look in our cases, I would say right now we are not seeing tourists as a big driver of infection. We are, however, concerned about importation of virus from other counties, but to date, it has been primarily through our residents traveling or bringing friends and family into the area.
Thank you.
Mm-hmm.
You have talked a little bit about the different alert levels on the new dashboard in the past, and for a while we were staying at level 2 before increasing to level 3. What does this alert mean for residents? What should they be doing differently than when we were on a level 2. Can you also explain the difference in level 3 and 4?
So, and I get it's a brand new system that we've put out there. And really what we're trying to do is give people sort of an overall impression of where we are in this pandemic, an overall understanding. So when we looked at this, green or level 1 is really not much happening, right? There's just, some sporadic cases, really not a lot going on in terms of COVID. We believe risk is relatively low at that time, but all the prevention measures we still want in place. That's sort of our new normal, where we use facial coverings and we do all those other things we've been talking about. Level 2 really just says we're starting to see a little bit more activity. We really want to emphasize this importance. And in 3, what we're really saying is that we're seeing some impacts of the virus transmission. We're starting to see numbers that affect things like our case rate that might impact us becoming members of the county monitoring list at the state level. That has economic impacts. So we want people to understand that. We want people to understand that as the case counts rise at a certain rate, it starts to have the possibility of impacting our contact tracing. That has implications for how well we're able to go through this. And eventually, there may be a point at which we're starting to see an impact on our healthcare sector. This alert system is a way we can communicate that to the residents of the county. And I think what we're really telling them as we go through in terms of people's behavior is, as we're moving through this, all of these prevention measures are more important than ever because we really are starting to get in more uncertain territory in terms of increasing transmission. So while we want people to be implementing these all along, we really want to just keep emphasizing that importance. And as we raise up, heading into like levels, as we're moving across these levels into 3 and 4, again, that messaging about us needing to pull back a little bit, to not be as active outside our homes is really important. At some point, it will trigger us moving back, just as, when we're starting to move through some of these levels, even within level 3, when we're seeing it impact other sectors, or our numbers in that level get more substantial, we may be, for instance, on the county monitoring list, and that will impact things like where our health workout fitness facilities will have to be outdoors, our places of worship will have to be outdoors. So we will begin to see this, and we don't want that to be a surprise to people. We want them to see that in this alert system, see the possibility that we're moving towards that.
Thank you.
Mm-hmm.
There have been 26 new cases confirmed in the 4 days reported from July 27th through the 30th, since the July 24th increase to alert level 3. What is the threshold to break to reach alert level 4?
Well, again, I think we mentioned previously that each of these little boxes on our alert level is impacted by multiple measurements. And so really what we have to see for us to move up would be things changing. For instance, even though we've had an increase in case numbers, our positivity rate is still, we're at about 3.5% right now. And we were about 3.8, I think, a couple days ago. And so we're sort of sitting in that realm. We haven't been hopping up in that. That's an indicator that might, help move us towards another level. And so we're doing that across all of these sort of segments of our alert graphic for the county. And, it's just the changing landscape. Every day we look at all of these multiple data points for each and sort of have, make a decision about where we feel we are.
Are there plans in the works to implement additional restrictions on top of the latest state mandate? And could we expect these restrictions to be implemented within the next 2 weeks?
So I have not, in my calls with other state health officers and CDPH, I have not heard discussions about increasing the restrictions at this time. Certainly doesn't mean that discussion isn't happening, I suppose, in the governor's office or elsewhere, but I'm just, right now, this is not something I'm preparing for because I'm not hearing it talked about in that circle. I think the big question for most counties right now are the relatively smaller number of us who are not on the county monitoring list is really trying to do our best to not get there so that we don't face those additional closures that we had just spoken about.
Thank you. You've talked about delays in testing results or making an appointment and how that impacts our total case count. Can you talk about how delays in testing impact contact tracing investigations? Does the delay in test results weaken the impact or overall goal of these investigations, i.e., contacting people too late and they've already gone out and about? They are no longer symptomatic or no longer need to isolate, etc.
Well, yeah, and we've sort of talked about this. It's a huge issue. It's the reason that at this point, we are encouraging people who have symptoms to see their provider for testing or contact public health if they don't have a provider, because we want to test those folks as much as possible in our local lab so that we can get a very rapid turnaround time and act on it, because that's key in our contact investigations. The quicker we find people who are positive, the quicker we can isolate them, look at their contacts, quarantine those folks, and limit spread. So as we're looking at trying to find a replacement for our Optum site, which although again has been a benefit to us for a long time, because of long turnaround times, is not operating as we need it to. As we look for a replacement for that, one of the key factors is identifying laboratory capacity that can give us a turnaround time that's more useful. I don't expect when we have to transport specimens out of the area to be able to get turnaround times of 24 hours like we can in our own lab much of the time, but I'm looking for turnaround times that are much more like 3 days as opposed to 6 to 10 days. And that will be very useful in helping us go forward.
How would you describe the level of cooperation you're getting and the effectiveness of the county's contact tracing efforts?
I think our county's contact tracing efforts have been amazing, frankly. I am in constant awe of our team. And the reason I say that is because I honestly believe they see themselves as the wall that is keeping our community safer. They are working incredibly hard to identify all the contacts of cases, to really get to people quickly. And again, we do this 7 days a week here. So our team has been working at this for quite a while. I think that in general, most of the people that we're working with are actually very cooperative. There are always going to be some people that are difficult to convince about the importance of this and to get the information that we need to move forward easily. But I think the vast majority of people we've been working with have actually been great.
Thank you. At what point would you urge local law enforcement to engage in a punitive approach to enforcing the masking ordinance for both businesses and individuals?
Well, first I just want to say that I am really grateful and quite encouraged when I move about our community. I see the vast majority of people using facial coverings. And I think that is quite something. And I think it speaks to the social contract we have with each other to try and keep each other safe. And it is also a marker to me that people are recognizing, the importance of this pandemic and the possible implications and are taking it seriously. And I really appreciate that because I think in the end, it's what's going to help keep us all safer. I am not someone who is, I would always prefer education over enforcement. And frankly, I would rather that, people's goodwill and feelings of responsibility for their friends and neighbors will convince them to do the right thing. And so, that's the approach I would tend to want to take. However, I will say that if people are going to, for instance, a place of business and employees are not masked, are not complying with the safety plans that they have made, then I encourage them to contact the EOC with that information. And I don't recall the complaint line number up front, but I know the JIC can be reached through 4415,000. And so I do encourage people. I want them to feel safe when they're visiting businesses. And I think that's perfectly appropriate. And then we can move on that.
Thank you. The fall semester at Humboldt State is beginning soon, and students are starting to move to the area. How concerned are you that we will see an increased spike in cases? And have any of the recent positive cases come from students moving from out of town?
So again, I understand people's concern about this, and just as I've been getting lots of questions about, K through 12 school, universities are another source of possible concern for people. We are working intensively with HSU to craft safety plans, to look at how the university would function in the time of COVID. Everything from how students are brought here, how many students are brought here, how that is phased in, where they are staying, what we will do if students are ill. So we really have been walking through safety plans with them in order to minimize the impact on the community if school starts as planned. And so we will update as we go forward.
Thank you so much for your time today.
Thank you.